There is limited data on SLE incidence and population level, and the few studies that do exist mostly investigate smaller populations, narrow short duration. Norway has universal public health care with most specialists, including the rheumatologist, based on public hospitals. For these reasons, Norway is one of a few countries where long-term studies of a complete population-based cohort in rare diseases like SLE are possible. In this study, we aim to identify and classify SLE cases resident in Southeast Norway, an area with a background population of 2.9 million people during the study period from 1999 till 2017. We then focus on the cases with new onset disease and provide estimates of annual SLE incidence. We also estimate accuracy of incidence estimates derived from ICD-10 codes alone, and present ecological register data on use of menopausal hormone treatment and smoking habits, both candidate risk factors for SLE development. To assemble the study cohort, we identified the 3,488 individuals ICD-10 coded as SLE in the study area during the study period. Then we performed individual level chart review to confirm or reject the SLE diagnosis, which confirmed SLE diagnosis in 1,558 cases. Of these, 797 cases had new onset disease during the study period, and a study end in 2017, 749 of the incident cases met the 2019 EULAR ACR criteria, whereas 763 cases met the 1997 ACR criteria. By time trend analysis, the overall SLE incidence fell across the study period. For the total population, the decline was 35%, from 2.0 till 1.3 per 100,000 person years during the study period, and by the 2019 EULAR ACR criteria. The decline was most pronounced at 68% among female subjects aged 50 to 59 years at diagnosis. When we estimated the incident rates by ICD-10 code, we found that all M32-based case definitions for SLE yielded higher estimates than the rates calculated from confirmed SLE diagnosis and classification criteria. When we analyzed ecological data from population-based Norwegian registries, we found that from 1999 till 2017, the percentage of female subjects in Southeast Norway who received menopausal hormone treatment dropped by 74%, and there was a decline in Norway in daily smokers aged 16 till 74 years at 69% for female subjects and 66% for male subjects. To conclude, our key findings were declining incidence of SLE over the last 2 decades in Norway, pronounced declining incidence for female subjects aged 50 to 59 years at time of diagnosis. The accuracy of ICD-10 codes for incident SLE diagnosis was acceptable in juveniles and adults up to 20 years of age, but otherwise low. The ecological data indicate a possible role of environmental exposures in SLE development.